Hi there, I'm Lisa Dowling from the Cupping Revolution. Just popping in here today to have a wee chat with all of you about some recent amazing media that cupping has been receiving. Maybe some of you have seen it. A very well-known NFL football player, James Harrison, has posed for the National Geographic magazine, and it's been all over Twitter, Instagram, and Facebook, and he's covered in plastic cups all over his back. So I just wanted to take a moment to speak to this. First of all, I give the highest kudos to the practitioner who put the cups on his back. He did an amazing job. It's an incredible layout for the condition that he's dealing with, which is pain and lots of trauma in his muscles. This is really, really great. So I'm sure the New England Patriots are thrilled that one of their star players is doing this kind of self-care for his enhanced performance. However, there's one thing that I do want to talk about to practitioners and people curious about cupping therapy is what I am seeing in clinic and also online is that many practitioners are treating every patient as if they're James Harrison. And what I mean by that is really that James Harrison is an elite athlete. We all know that. He takes great care of his body. He exercises, he stretches, he gets massage on a daily, regular basis. He is in amazing shape. His cardiovascular health is completely optimum. He's an older player, so he has lots of trauma, lots of injuries in his body, but he has kept his body very, very strong. So for James to have a cupping treatment on his back with the amount of suction that he has, it's completely appropriate for him. However, unless the client walking into your clinic has the kind of blood circulation, muscle strength, and cardiovascular strength that James Harrison is, that depth of pressure may not be appropriate for your client. So if your client is not James Harrison or Michael Phelps or Roberto Osuna walking into your clinic, they're also not going to be those people walking out of your clinic. So, very important to understand the function of cupping therapy. Very important to understand the indications and the contraindications of cupping therapy. Cupping is a very simple modality. It's very easy to use. It works amazingly well. Clients love it. They feel great. They feel great afterwards. Unfortunately, even sometimes when we overdo our cupping treatments, our clients feel great afterwards. So it's not very good feedback to us to let us know that we've gone too far. The problem is we may not know that we've gone too far, we may not know why we've gone too far, and we may not know the consequences of going too far. And what I say to my students is, it feels great until it doesn't. And when it doesn't, you have big problems. And the big problems I'm talking about are blood clots, major circulation issues, big detoxification, negative treatment reactions, blisters, bleeding, real bruises, not petechia, which are red marks, but real bruises on the body, and pain. These are all signs that the treatment was too strong. So how do you know? Well, the best thing to do really is to take a proper training in cupping therapy so that you understand the reactions in the body when you apply the cups, so that you understand before you even lay the cups down what the most appropriate treatment is, because there's many kinds of cupping. Stationary cupping like we see on James, like we saw on Michael Phelps. There's moving cupping, gliding techniques where we move the cups. There's fast cupping, which is very generating and stimulating. And then there's a few different ones that we can practice that kind of lay in between these techniques that are very condition specific. So this is why we want to take a training. We want to take a proper training, and we can do a training that is specific to how we work. So personally, the Cupping Revolution has a course, Cupping Therapy for Acupuncturists, cupping therapy for manual therapists, and cupping therapy for fitness professionals.